Good afternoon, everyone. Welcome to a Brilliant Businesses podcast. My name is Nick Bryant, and I'm very pleased today to be joined by Jane Holman. Good afternoon, Jane.
Good afternoon. Thank you very much for having me.
It's a pleasure. So Jane is a fertility specialist and a nurse manager, and we're based here at the Amara Clinic in Tunbridge Wells. But Jane works out of a company called LCRH. She works alongside a lady called Dr. Lynn Chapman, and they collaborate with leading specialists to provide outstanding personal care for their patients, at every stage of the journey. Jane has over 25 years experience in the field of women's health, and from medical and surgery through to family planning, and specialising in fertility and assisted conception. Where have those 25 years gone, Jane?
Oh gosh, good question. I came into fertility and women's health by a mistake, really. I suppose I was working in various areas when I did my training, and really enjoyed relating to I suppose women, healthy women, and decided to sort of specialise in an area that I could support them further.
Okay.
So initially I worked at King's College Hospital, and I worked with a couple of renowned sort of experts within the field that were working in IVF, fertility, general women's health.
Yeah.
And I had a lot of opportunities, really. I had opportunities as a nurse to learn to scan, to do additional qualifications in ultrasound.
Okay.
I was able to expand the nurse's role, and was very much encouraged to manage patient cycles, support patients going through the fertility journey. And that, I suppose, one thing led to another, really.
Yeah.
And I suppose my expertise grew, and therefore I wanted to utilise that more. And as time went on, I was with King's for a number of years. We had the opportunity to go overseas, to set up clinics, to train, to support other members of staff, so nurses, doctors, and really sort of, I suppose, put the word out there.
Okay.
And that was in the early days of IVF. So things, as you can appreciate, have changed quite considerably. Reproductive medicine does, and even more so these days. From there, I went to the Chelsea and Westminster, and I was a nurse manager of an IVF unit, and I had, again, opportunities to build a clinic, and expand that again with some other members of IVF and fertility that are quite renowned.
Okay.
I also was seconded to do a placement to work in general gynae, so I covered medical surgery, so I could claw back on that experience that I'd had from when I'd sort of trained and in the early years, which was great for me because it sort of kept me fresh and interested. But I then ultimately went back into the IVF role. And from there, I then moved locally, actually, to the Tunbridge Wells area to work with two consultants to set up a clinic in Tunbridge Wells, which is now a thriving clinic, which is doing really, really well. So it's lovely to be part of that and to project manage that. Yeah. So again, I suppose my skill set changed a little bit. Never ever losing that clinical role, and always being involved very heavily with patients. Yeah. And I suppose then I went on to develop into more of a project management, working in setting up clinics. So I then moved back into London and set up a clinic for an overseas company. Okay. And that, again, is a thriving clinic, which is great. So for me, it's also about sort of working with younger members of the team to develop them and I suppose, explore their opportunities and expand their skill set. Yeah. And then more recently, I worked at a clinic called IVI, which is in Wimpole Street. So that is in London, and that is part of a global, probably the global leaders of IVF. Okay. It's a Spanish group. And that is where Dr. Lynn Chapman and I started working together. So we built our friendship there. Yeah. And we worked together for a good number of years. So we got to a point really when we were both thinking about next steps, where we thought, okay, so what can we do slightly differently for patients? What can we do where we can support them and carry them forwards in more of a bespoke, sort of personalised way? I think it's very hard for patients when they go through this process because, quite often you can go to bigger clinics and sometimes that personal touch is lost a little bit just purely because of the size of the clinic. So both Lynn and I decided, no, we would step aside. We would offer something a little bit different, a little bit of a challenge for us as well, because Lynn wanted to set up on her own. So I jumped on board with her.
Excellent.
So we've been together for, Lynn started 3 years ago, and I supported her with patients initially, but actually started working together, solely together as a team 2 years ago.
Okay.
So that's my background.
Yeah, that's your story.
It's
Yeah,
a bit of a long one, so I apologise.
That's great. I think what's good about here in the Amara Clinic where you're working from is it doesn't feel clinical. It's such a lovely space, and I think that must be really important when clients come and see you for the comfort and for them to make them feel at home or relaxed.
Yeah, definitely. I think for a lot of patients, they've been through this journey, and it can be quite a lengthy journey for a lot of them. That association with the clinical sort of setting is not necessarily positive for some people, and it's just nice to remove them from that and make it a little bit more homely. Absolutely, the Amara is a beautiful setting. For us, we've been collaborating with the Amara for a little while now, and it had to be the right feel. And coming into a women's health setting is perfect for us, because it could offer almost like the holistic sort of care for our patients, which is so important.
When we were speaking earlier, you said you had a WhatsApp message at 6:30 this morning from one of your clients. I mean, it doesn't stop, does it? But you must get so much satisfaction from that.
It is.
Yeah.
It's hugely rewarding, and I think we feel so passionately about what we do. That's the driver, and we're there for our patients 24/7. I know that seems hard, but it's what we want to do, and for us it's about delivering the whole package. So from start to finish, the patient's journey is for some it's lengthy, and for others it's tough. It doesn't always work, unfortunately, but it's about, I suppose, making sure that we provide the best possible experience that we can, with hopefully that positive outcome at the end of it.
Yeah, that through the whole process, even after the birth of the child as well, you sort of get involved in.
Absolutely. It is. I think it's very hard. Maybe the downside for Lynn and I is that we struggle to let go, and the rest of the team, we are, I'd like to just sort of add that we are a very close-knit team. And also, I think for patients, it's nice. It's hard for patients to let go if they've been so cared for during that process. We all feel as elated as the patients when they have that positive. As I say, at 6:30 this morning, I was woken up to a WhatsApp message, which it just
That's
warmed
great,
my
isn't it?
heart, because it's so lovely. The patients have been through so much, and it's just nice to.
The fertility process doesn't always work, as you said earlier, but I believe that your success rates are really high.
Yeah,
Can you
absolutely
give us some examples?
So I think we obviously are reviewing our stats all the time. They are genuine statistics. We're very proud of them. And I think a big part of that is because we do get to know our patients right from the very outset. So the patients will get the continuity of care. That's so important. We see them through. We offer what we feel is in their best interest the whole way through. With our patients that are having genetic testing, which gives an indication of the normal chromosomal complement of an embryo. When those embryos go back, our statistics at the moment are phenomenal. They are running at about 70%.
Wow.
For patients that start a cycle. So not everybody will get to that point of having normal embryos, but when they do, again, it's about making sure that the patients are, I suppose, informed at every stage, and can make those decisions about next steps. So we are very proud of our success rates.
Yeah. And also, you mentioned earlier that everyone that works within the clinic or within your organisation have been involved in, or had their own experiences with fertility as well. So therefore, they've been to sort of areas or other clinics that you've seen gaps in, or they've seen gaps in, and therefore you can make them a bit better from what you do.
Of course, and I think that's really, really important.
Almost learning from other people's mistakes, right?
Yeah, that's the thing. And I think also it allows us to be very empathetic with the patients and what they're having to go through. It is very, very difficult, and I think Lynn doesn't hold back in letting patients know that she has been through that IVF process herself. So she can really relate to the patient's journey. the pain of the patient's journey, because it is hard. And I think everybody that has an association with LCRH can bring something to the fore. To hopefully help the patients on their journey.
Can we talk about the male side of it? Because the male factor in fertility is a big part, isn't it? And how
it's a huge part. It's a huge part. And also, I think for various reasons, I think it's really important to involve the male partners, because they can feel very much on the periphery when they are going through this process. Male factor infertility is a huge contributor to probably about easily half the number of cycles that we see. And it's so important that we, I suppose, dissect everything right to the nth degree to make sure that we are offering the most suitable treatments for patients. So we do work very closely with a very renowned urologist called Mr. Jonathan Ramsey, and he works very, very closely with us as a clinic. And obviously we appreciate his recommendations and guidance and advice. Quite often we overlap with him if we feel that it's necessary. We see patients that come to us because they're desperate, and that the male factor side has been overlooked, because it is an area that hasn't always been focused on in maybe the depth it needs to be. So there are a lot of new treatments that are available for us to be able to explore, support, and I suppose change the treatment options for patients. And I think that's really, really important as well.
Definitely. And also the mental support and the counselling that may have to come with it as well. You offer that as well, don't you?
Definitely. All of our patients will have that as in part of the inclusive package. So for us, I think it's we look at it as the counsellor is part of the team. And it's very important for patients to know that they have that included. It is available. We do encourage patients to utilise that, and if more than one session is necessary, or if it's advised that we maybe park treatment for a little bit until patients are in a better place, in a better state of mind, then that's really important to us. And it's seen as the norm as well, because it's the support that patients need. So we do work with we have 3 counsellors that we work very closely with. We have different locations, and we have patients that can see counsellors either face to face, or they can have virtual appointments. So.
Who else do you have in the team with you? Obviously, I know you and Lynn, but tell us about the other people.
So we have, at the moment, our clinic manager is called Alicia. Again, she is very young and vibrant, and she supports us very much with our administration, and holding, I suppose, the clinics together with regards to things like booking appointments, communication with patients. But she does dip into the clinical side as well. So she is multi-skilled and a very vital member of the team. She's lovely. She's been with us since the start. We also have Sarah Simone, who is Lynn's PA. So she will support patients. She takes quite a lot of the new inquiries, because Lynn and I tend to be very clinical. And that, again, is really important that patients get that continuity and that expertise, because Sarah has got a lot of expertise as well as personal experience with the IVF journey. We also have Rebecca, who is one of our nurses. So she is a fertility nurse, and she's a fertility midwife as well. So she brings all elements to the patient's journey as well. And she can scan. So she is a valuable team member alongside me in supporting patients. So there's not many of us, but we do very much work closely. We also work with 3 counsellors. As I say, obviously for the Tunbridge Wells area, we're working very closely with Zoe Townsend, who is a psychotherapist, a trained psychotherapist, and again, exceptional skills, and supports patients throughout that road to success.
I mean, we really want to sort of raise the profile of LCRH not only in the local area, but the southeast, I guess. And because you have got offices in Harley Street, or you had some presence in London anyway, didn't you?
Yes, that's right. So we have got a premises in Harley Street, which is where we see patients. So that's for new consultations. We can do minor procedures there as well. And both Lynn and I and Rebecca also do scanning clinics and consultation clinics there. So they're not. We don't work there full time, because obviously we're covering all of our sites. But it is nice for patients to have the option. Some of our couples, professional couples, may be working in London, and it might be more convenient for them to have an appointment in London, and then potentially some of their scanning appointments down here in Tunbridge Wells, which is the aim ultimately, to almost provide that satellite provision for our patients.
Is it maybe an option that people would prefer to come to Tunbridge Wells because they can come, if they're in London, because they can come down to the countryside, it's a nicer area, it gets them out of their environment. Maybe that's a positive.
Definitely. We have found that as well with our Beaconsfield clinic. We have patients from all over. We've had patients from Wales, from Scotland, and we even have, Sarah's fantastic in sort of supporting patients in trying to organise accommodation and hotels and things like that. So we have had patients that have come down to stay in the Beaconsfield area towards the latter part of their treatment, so they can be more available when we need the flexibility to see them maybe a little bit more frequently, leading up to the point of their egg collection.
But do you ever get situations where people have been elsewhere and it doesn't work out for them, and they're unhappy with where they've been, so they've knocked on your door, if you like?
Yeah, absolutely. And I think that's a really important one, because there are patients that will not have been successful through other clinics, or maybe will have been to another clinic and just didn't get the right vibe. So we see those patients and we will assess those right from the beginning. We will see what investigations they've had done, and we will recommend anything further that we think will benefit them in the bigger picture, to make the right decisions for our patients. We put that to them. They will then make an informed choice as to whether they would like to proceed with treatment. And it may be that there are some patients that we don't feel are suitable for the IVF journey. We may need to look at alternative treatments for them, such as egg donation or surrogacy, and we can support them in that route as well. We do collaborate with other clinics should we need to, and the provision of eggs if we need to think about egg donations. So there are alternative options there.
And you get referrals. You mentioned that there was someone around a dinner table that someone said they're having trouble, and someone said you should try these guys. Stuff like
absolutely.
that.
I think that's the thing. We started off small. We have got significantly bigger. We haven't really been marketing actively at all, so it has been very much word of mouth. And I think that for us as a team is really heartwarming, because it's how we wanted, or how Lynn wanted the business to build, and that's really reassuring, because it tells us we're doing the right thing. Absolutely. And that's ultimately our goal, is to support patients moving forwards.
Absolutely, good job.
So.
I think what comes through here is it's the personalised service that you offer, and the fact this is like a little private boutique small clinic, which isn't really like a clinic. It's so unique like that, and I think your clients probably really like that, and like the way that you are comforting towards them.
I think that's really important, and I think was probably one of the drivers why Lynn wanted to go it alone, and also why I wanted to join her, because I think for us it's, we've worked in bigger clinics, we can see maybe where there are those little voids for patients, and where if you're an employee in a clinic, it's really hard to tick all of those boxes as much as. For example, in my situation, being a nurse manager, I've got a bigger team to manage normally, and there's a large number of patients throughput, so you cannot possibly do absolutely everything for that patient. Whereas in this sort of setup, it's different. Lynn and I are very passionate as to the patients, the care we provide. We get to know our patients very much, and it's about that continuity element, and we provide that, whether it's me darting to Beaconsfield to do a clinic, or Harley Street, or taking here in Tunbridge Wells,
or taking a WhatsApp at 6:30 in the morning, anything like that. So that's really good. I think if anyone wants any help or any information about fertility, then they can go to your website. They can call you up. There's a form on the website. How do they do that?
Yeah, that's fine. And there's contact details. They can always reach out. Sarah takes a lot of the initial inquiries. I can provide information, if it's just a little bit more of the clinical input that is required. Obviously, Lynn is available for consultations. And she would be the one that would oversee the care of all patients. But I very closely follow sort of along with Lynn in that respect. So by all means, reach out.
Because are people nervous about that, reaching out, do you think? Or?
I think think there's more of an awareness these days,
Yeah.
and I think people are, I think the knowledge base is much greater, and patients are more willing to move forward quicker.
Yeah.
So
okay.
I think, having the confidence to speak to somebody, to air their concerns or their feelings or what they need, we can certainly provide that. And if it suits, and if it's what, if it's what you're looking for,
Yeah.
then great, we can see you in clinic for the consultation. It may not suit everybody, but it does certainly suit a lot of patients. That
How can they walk in this door and it not suit them? I don't understand it. It's such a lovely place.
It is. We're very fortunate.
Yeah, yeah. Well, thanks, Jane. It's been great to talk to you. Thank you for telling me it's your journey, and I think this place is awesome, and you've obviously done a great job. So
Fabulous. Thank you very much.
my
for
pleasure.
your time.
Thank you. And we'll
Excellent.
see you for another podcast soon. Thank you.
Perfect. Thank you.